presentation Dr. Pragya Ahuja available? Yeah. So she will be presenting on donor profile, mode of collection and tissue profile of voluntary versus HCRP corneal donation.
Good morning, respected judges and fellow colleagues. I'll be presenting donor profile, mode of collection and tissue profile of voluntary versus HCRP corneal donation, a 6-year analysis. On 25th March, lockdown was declared, wherein donor organ procurement and screening as well as general reorganization of health services had a profound impact on the delivery of organs. India generally follows an opt-in system of eye donation, wherein individuals or the next of kin generally manifest their preference for donation. Eye donation can be voluntary or hospital-based, wherein in hospital-based, a trained professional grief counselor motivates the family of the deceased for donation in hospital setting. Available medical history, access to younger tissues, and less death to retrieval time and cost effectiveness has been conventionally declared as advantages of HCRP. Ours was a retrospective research study. Donor corneas received in the eye bank over 6 financial years from March 2017 to 23 were analyzed. Donations received before lockdown, that is from 2017 to 20, were categorized in the pre-COVID category, and those from 20 to 23 were in the post-COVID category. Total of 7,741 corneas collected over 6 years were included in the study. 53.4% of these donations were from males and 46% were from females. No significant correlation was seen between the gender and voluntary donations over these years. 30.5% donations of donors were patients of less than 50 years, less than 50 years were voluntary donations, and more than 50 years, only 52.4% donations were voluntary. There was no significant correlation between the age and the voluntary donations received. We saw a trend of donations over the years, wherein during the COVID era, HCRP donations decreased, while the voluntary donations did not see a significant decline over the years. However, instead, post-COVID, the voluntary donations have increased in overall. The number of optical tissues collected over the years from voluntary donations we saw an increasing trend. While in HCRP it was 766 in the last, HCRP it was 453 in the last year, while it was 527 in voluntary donations. Tissue grading, most of the tissues received by voluntary donations were from fair to very good, and those received from HCRP were those received from HCRP were of good category. 68% of tissues from voluntary sources in the COVID era were in the COVID era, while 44% of the good tissues were of good category in the pre-COVID era. Those in the HCRP group and 60% in the COVID group. The utilization of tissue for optical purposes increased significantly in the voluntary donation, 26.3% in the pre-COVID versus 35% in the COVID group, but no such significant increase was seen in the HCRP group. The tissue utilization between the two groups was significant, with the tissue 84.6% utilization in the voluntary group and up to 84.3% in the HCRP group. The comparison between these pre and post-COVID independently in the voluntary and HCRP categories was significant. Public awareness programs are active for the last few decades with financial support from various NGOs, which has helped improve the percentage of voluntary eye donations. The major disadvantage of these is that the next of kin needs to realize the responsibility of eye donation, and the motivation is a drawback which helps in because of which most of the studies reported from other parts like Nepal Eye Bank and Delhi have seen only very few voluntary donations from 12 to 20%. Increase in optical tissues is compared from voluntary was comparable to HCRP in our study. We emphasize more focus on IEC studies with the need of removal of stigma around eye donation. Thank you.
Thank you, Dr. Pragya.
Thank you.
Next time, make your slides little less crowded so that you can give more information in lesser time.